how AI, generally it's the buzz of the entire industry, but how important AI is in healthcare and how it's more foundational rather than, just being an option for companies to be working on AI.
All of this stems from a very simple fact that health is a very domain-specific, deep subject. There is a data availability across other domains in a public domain or on textbooks and so on and so forth. But when we look at health is not a transactional ecosystem. It's basically your health is the outcome of your health is basically multiple steps that you have taken.
So this probably is the only stack, the space that we are in, which cannot be solved if AI is not at your core. Eka is not only about, say, a prescription pad. Eka is about when that conversation is happening, both the parties can extract maximum output out of that particular setup, where they both can trust that particular platform with their data, with their conversation, and can understand each other much better. So that is what Eka is about. There will be more products. And typically, when we were analyzing this thing, this was Vikal's saying long back that a health stack which is solving this problem and not bothering about AI or using AI as a tertiary setup will be a lip service. So this probably is the only stack, the space that we are in, which cannot be solved if AI is not at your core. So that's what the journey has been for the last 4 years, if you see, right? 5 years flag. From day one of our journey, and this is the 4th year, we can safely say that we have not pivoted. Of course, there are tactical pivots that will always be there, but strategically, we have been on that same problem statement again and again and again, because what we believe is that that problem is acknowledged. Every metric that you have to look at is getting solved.
So, welcome guys. It's been some time that I have asked questions to all of you behind the camera. I think in the first year I asked just Vikalp and Deepak, where the idea was to focus on letting the entire company know about our co-founders. The next year it was the entire leadership team. And this year, since we complete our 4 years in April this year, we thought we'll go a bit beyond and we'll shoot a podcast with a lot of our learnings in the healthcare ecosystem, which we can share not just internally within the company, but also outside with other entrepreneurs, specifically in the healthcare domain, so that they can also learn, collaborate with us and, build together a stronger, healthier India. So I think we'll start with Vikalp. We can probably start a bit about your journey. We can start from discussing how AI, generally it's the buzz of the entire industry, but how important AI is in healthcare and how it's more foundational rather than, just being an option for companies to be working on AI.
Yeah. No, thanks again for the invite, but I would maybe take this question in two steps. One is the whole journey and how this journey culminated into being such a important sort of a consumer and creator of health AI. So yeah, the journey started with, I think, from travel to health through Arogya Setu, so to say, with a very clear focus and thought that we as a company should solve for health data, which eventually should solve for the health outcomes. And digital data, digital health data in our country and globally also is not very sort of easy to generate. I'm sure many of us would know that there are thousands of or hundreds of codification companies in the world, especially for the US market, where there are documents that are getting generated, and these documents needs ICD codes or health data sort of salience around those documents, and there are humans who are actually doing these. And many of these things I sort of got exposed to when I was doing Arogya Setu, and many things happen in the family as well, that the data of my father's diabetes values is not available digitally so that it can be easily shared. That's how all of this started. And in any journey of a startup, like we've just done 4, it's a roller coaster ride where you learn, especially for a team like us. A lot of us have done travel and multiple other things, but I think none of us has done health. So the learnings were phenomenal, right from building out the technology to doctors, trying to monetize that, leveraging various different innovative techniques, and eventually leading to AI. While I think it seems like now AI is the buzzword and Eka is using a lot of AI, but the vision at that time itself was that fundamentally, if you want to change the ecosystem and especially health data or digitize health data, the classical approaches might not work, or else we would have seen a very large scale adoption of EMR in countries like us, or doctors would be talking highly about the technologies and capabilities that they use to generate these digital health data. So since the beginning, and thanks to Bhaskar and Sankalp, definitely you will have questions for them as well. But the focus for them has also been that we will invest on doing core data science, AI-led stories since the beginning to solve for health data. All I can say is after sort of 22, there is a lot of fuel that has been added to it, specifically with the advent of LLMs. They are becoming more ubiquitous and easily accessible, a lot of work happening around voice and text. What has happened is the work that we have done is now, I think, is all on steroids. That the models or the capabilities that has been built to generate relevant health data is now far better and far more scalable. Similarly, on voice, there is a new charter that Eka has started where voice also will take a very big part in solving for these capabilities. And all of this stems from a very simple fact that health is a very domain-specific, deep subject. There is a data availability across other domains in a public domain or on textbooks and so on and so forth. But when we look at health, health is not a transactional ecosystem. It's basically your health is the outcome of your health is basically multiple steps that you have taken. It's not that, okay, I've done this and I've, especially now with non-communicable diseases are growing. And this would need longitudinal data. This would need rich data. This would need data that is not available outside. And EMR companies or hospitals, we are all well poised to build capabilities that can solve for these deep use cases. And that's why there is even more excitement and investment from Eka perspective to invest on health AI. And yeah, as a developer, there will be specialized health models that will solve for a large needs in healthcare, and not only just the SOTA models. So yeah, I'll maybe
maybe Sankalp, you can add a bit on this in terms of why, in the healthcare ecosystem or for doctors, a generic LLM model won't be good, and why do we need a LLM model that's specific to the healthcare ecosystem? And maybe a bit about your journey towards building Parrotlet and how the entire experience has been.
Yeah, so I think this is one topic that maybe we have discussed the most, like why do we need certain approaches specifically tuned for healthcare? And I would say a step more than that, like for a regional level,
not just within healthcare. And I think in the most sort of tangible way, even if we look at some of the common problems of LLMs, let's say hallucination, right? And simple things like cost of that hallucination in different sectors, maybe like in healthcare, it's the most, right? If a model does some mistake in, let's say, when you're using it for coding versus you're using it for some healthcare outcome dependency, it's a disproportionate amount of cost that, what if it goes wrong? So I think that's one. And honestly, like these LLMs are trained to basically generate coherent text given a question, right? And things are changing, but in terms of how the models have to be guardrailed around when to say no, when to say yes, when to not respond to queries will be a very different way to look at in the context of healthcare. So that's one to begin with. And also like Vikalp was mentioning, it's very layered, like healthcare and some of these topics are very, very contextual and nuanced. So for example, let's say there's a case study, right? And patient data involves like huge amount of history, records, and looking at a large volume of things. And then there is one small place where a doctor mentioned that let's say the woman was pregnant, right? It completely changes the way the model should respond, right? So such small things, these models are getting better at needle in a haystack problem, but still we're not up to that mark. So given such a nuanced sort of and contextually sort of dependent nature of the problem, I think there has to be a specific way these LLMs should be treated, guardrailed, and fine-tuned on some of these applications. And this doesn't just sort of stop at a patient context. A lot of it, like for example, the voice project that we are now getting started, it's essentially a patient might be describing their symptoms, right? And when they are describing, they would be doing it in their language, their dialect, their colloquial way of describing a symptom, which basically means that one should be aware of all those nuances, right? And that takes it to a very different level. The LLM should be aware of these cultural nuances and localization aspects.
And generally, if you were to go a bit deeper, how much additional time and monetary investment would it take to, let's say, make the model work across different languages? So let's say today English is working and Hindi is working. Now, if we were to add 2 more languages to it, both in terms of time as well as money, what kind of effort and investment would we look at?
The answer will be very contextual, but I think most of it, like if things have been figured out, most of it will boil down to basically collecting data in those languages and taking care of different aspects. So I think the answer, I'm afraid, will be very contextual. But I think to add to the previous point, it could be both the approaches. One could think of LLM as answering from the implicit memory that the LLM is trained on, and there are many limitations to that. Like the entire knowledge gets basically frozen, right? And we wouldn't want that to happen in the case of healthcare. So ideal combination would be a sort of a contextually trained LLM together with either RAG or an efficient tool calling that is basically linked with very efficient, up-to-date knowledge bases, which is the approach that we are essentially taking in Eka Care. So that's how I think the treatment of LLMs and how you use it in different applications would quite significantly differ from some other applications.
One of the good example that we keep talking about is if I ask you, and coming from that colloquial sense, मुझे गोला आ रहा है. What does that mean? Is a very, very different, might be sitting here, only Bhaskar would be able to guess that. I was not able to guess that when this was being described by a doctor.
This exactly means?
I think it's some reflex, yeah. It's a Haryanvi, yeah.
Nice. No, but like if we have to see last 4 years, and I think we've discussed how data is at the core of it, but when we see the healthcare ecosystem, right, doctors have traditionally been very used to creating prescriptions by writing it down using a pen and everything, right? And when we see today where Eka is, we are actually charging doctors to use our EMR software. So how was this entire journey, so to say, where, doctors from writing paper prescriptions are now loving a tool so much that they end up paying us annually for that? And, how has that progress been for us?
No, so see, when we started this whole journey, what we are very clear, and do take note that we come from a very, very heavy transactional background. But effectively, the worst place to be a transactional platform. So you need certain rails to be there for one to be a good transactional platform. And of course, there is a very clear relationship between, say, someone who seeks to put forward his or her service and someone who wants to take that. A transactional platform cannot be an ecosystem where probably you are concerned about something very deep, very, very private for you. You're going for guidance somewhere, and that guidance is ultimately related, say, resulting itself into commerce. So, see, if you think the whole care, probably when I'm talking about care, take preventive care to start with. Preventive care is nothing but a space where someone is having a very private something which is very, very critical to him or her, that conversation with a person who he or she trusts a lot. I'm talking about, say, a patient and a doctor. So core is this. When we started analyzing this whole ecosystem, we realized that other than helping both the parties get maximum out of that conversation, everything else was being sought. Which means what? Effectively, there were softwares who seemed to be in that whole medical space, but there was nothing medical about it. People were solving for billing, people were solving for, let's say, downstream flows coming out of that whole consultation, inventory management, asset management, you name them, and typically administrative part, which is important. But the core part, if you want to basically say that there is something you want to make an impact on medical side of things, it has to be how that conversation between a doctor and a patient helps both the parties get maximum out of each other. So our goal or our thesis always was to basically make an impact there. Incidentally, being a startup, we had to try multiple things, but we said that fine, if we have to do something, it has to be something that doctors love. If you're not doing something that doctors love, your chances of success, and you will be successful, but then your right to basically call yourself a medically aware platform or something, an outcome oriented platform, probably will take a hit if you're not close or loved by doctors. So that was the whole thing. Incidentally, we launched a pad, we call it a doctor's pad. It was loved by a lot of doctors. We built out on it. But Eka is not only about, say, a prescription pad. Eka is about when that conversation is happening, both the parties can extract maximum output out of that particular setup, where they both can trust that particular platform with their data, with their conversation, and can understand each other much better. So that is what Eka is about. There will be more products. And typically, when we were analyzing this thing, and this was Vikal's saying long back, that a health stack which is solving this problem and not bothering about AI or using AI as a tertiary setup will be a lip service. So this probably is the only stack, the space that we are in, which cannot be solved if AI is not at your core. So that's what the journey has been for the last 4 years, if you see, right? We have not, I'll be very frank, from day one of our journey, and this is the 4th year, we can safely say that we have not pivoted. Of course, there are tactical pivots that will always be there, but strategically, we have been on that same problem statement again and again and again, because what we believe is that that problem is acknowledged. Every metric that you have to look at is getting solved when you basically analyze it from a investment or capital, or probably say how much money you want to put at it. It's not yet solved because it is tough. It takes time. It takes a lot of patience. So that's what we are at.
I remember during our first year when we were launching, in fact, the V1 of our prescription pad, I think there was a lot of focus from Vikal to ensure that, it has to be medically coded. Everything has to be medically coded. It has to be codified, and the data has to be aware of should be easily understood by code. Looking back over the last 4 years, how do you think being very sticky to that decision right from day one has helped the company overall, and specifically more so in the recent past, with so much more emphasis on having a smart output of the data that we generate and gather.
Maybe I'll go with a small quote that I think it was Jeff Bezos' quote, that you should be stubborn with your long-term vision while flexible with the nuances of that journey, right? So that's what I think it's in summary, that the long-term vision is to solve for, and Bhaskar put it quite nicely, that interaction is where the maximum value is. But it is very tough to solve for that interaction. So, including the interaction that a patient has with a lab, or the interaction that the patient has with a nurse, right? All of this is where the medical data gets generated, which eventually boils down to that one individual, doctors, who can actually take the right kind of an action for the better outcome. And I think that long-term vision has always been to solve that and go back continuously while, and I mean, you all know running a startup is about hacking around during the journey, doing things that can make you at times feel that, okay, are we going towards a different path, and so on and so forth. But I am pretty glad that eventually we still are solving the same deep medical data problem that solves for the doctor's need, eventually solving for the patient's need. And what has happened in this journey is that the learning that we have and the realization that we have is there is this technology that obviously can be productized and used by patient and doctors, but the technology is far more powerful that can actually be leveraged by any health tech company or anyone who is working on health, be it a hospital or clinic or insurance companies. So if I look at it more to see from a parallel perspective, our thesis have taken us from a journey where the outcome is not only a product, but a technology, whatever we are building, that can build products very similar to what we do with OpenAI or a Claude today. Like there are retail applications that you and I use when we want to run our questions and answers. But I think thousands and thousands of tech companies are today leveraging the APIs, be it for voice conversations or for text conversation, for running their call center, and so on and so forth, which eventually would make the whole product look more like a end-to-end AI platform. Similarly, that's how we are now scaling up as an end-to-end health AI platform, still solving for doctors, making sure that patients can reach to the better outcome. And by the way, doctors only care for that most. See, there is, like when I develop a code or a businessman runs a business, we code for the best outcome, right? Doctors also, they want to provide the best outcome to the patient. And whatever we can do to aid that, or whatever we can do to let the patient have a control so that he can eventually give that information to his doctor, we'll continue to do that while building this platform.
Could you, we just spoke about how other companies can also collaborate with us, and could you probably elaborate a bit more on that or give some examples on how, and also why this approach of enabling someone else to build on top rather than building it ourselves?
Yeah. See, what has happened over a period of time, and thanks to technology, the platforms has emerged. And to give another example, and let's take Amazon itself. Amazon is one of the largest e-commerce company. And if I had to start basically looking at AWS, Amazon would be also the largest e-commerce platform for the other companies as well, who will build e-commerce solution on top of Amazon. be it by leveraging their AWS services and so on and so forth, right? Now that gives a very different sort of a ecosystem building capabilities. That it's not that you are only solving for the problem where distribution to adoption to operations, everything is guarded by you, right? You say that, okay, I've built something that can actually give wings to the other organization by providing technology building blocks so that you can leverage the power of distribution, you can leverage the power of innovation, power of understanding by giving out this technology, maybe as an open source tool or as a developer platform, including data for that matter. And Sankalp should definitely talk about our ambitions with open sourcing a lot of this data and model. So the idea there is eventually the work that has happened to solve for the health data, can that be ubiquitously available across the board to other health tech companies, insurance companies, and so on and so forth, so that we take this path much faster of digitizing. And we are always of a believer that it's not one who can. There's an ecosystem that when it comes together, it drives the big change. And I think we are a big proponent of that. And that's why this developer platform that we have built and these APIs that are available for health tech entrepreneurs, innovators, companies, large, small organizations to leverage and build their innovations on top of it.
And I think we recently launched the Eka's MCP server, and that host received pretty good traction with some developers even going on to build something on top of it within like a couple of days of launch. Could you explain first what Eka's MCP server literally means more in a layman's language, how a very average person should interpret it, what grounding intelligence means in this context, and what was really the thought that was going behind while building these tools for the ecosystem?
So I think in the most sort of simplistic way, I'll leave the engineering nuance for Vikram to comment on those nuances. But in a very, very sort of broad, simplistic way, when we are, let's say, chatting with a LLM, be it like a Claude or OpenAI or any other LLM, we are mostly using what it has learned during its training, right? And like I said, like which might be outdated, which many of the localized concepts might not be represented in the data set used for training those things. So, and there could be many other sort of contexts. So, Eka's MCP server is essentially a way for these LLMs to access our knowledge base. That's one sort of way we have exposed through these tools. So, for example, I'll give you an example. I think it's best to do that. So, for example, there is this drug Jolopar, like, and there are thousands of them, which is not as popular as, let's say, Dolo, right? If you ask an LLM, hey, like, what is the salt composition of Dolo? Most likely, it will not make a mistake because it would have seen this drug so many times, right? That it understands that maybe Dolo is like paracetamol. But on the contrary, if you ask like what is like Jolopar or Jorolac, Jorolac, I think. So if you ask like what is Jorolac and many other like Zintan tablet, most likely it will not be either able to answer or hallucinate because it's so underrepresented at world level that these models wouldn't know what to do with that, right? And there are many terms when we deal with any medical context. It's full of these kind of entities, right? Named entities. So what we have exposed in terms of MCP server, one of the knowledge bases is for checking these drugs and the associated metadata. So we happen to have curated a good set of drugs along with associated metadata. And then when we are doing any conversation with LLM, whenever there is a mention of any drug, the LLM can just check with the data set and then augment that so that the output response is more meaningful. And this can happen when we search for drugs as well as for treatment protocols. So that's another database that we have sort of linked with the MCP tool. It currently handles around like 180 sort of protocols from different authorities, published protocols. And then that's how a person who is doing a chat with the LLM can basically access this knowledge bases. And going forward, we plan to sort of expose many of these knowledge bases and different sort of tools and functionalities in the similar way. So yeah, so that's, I hope that gave you some context.
Considering last 15 minutes, I think we largely spoke about, the developer platform, different integrations that we are doing. More from a, product perspective, how do you see, when we are talking about scaling the startup, specifically in the health tech ecosystem, right? Scale could mean, probably adding 1 million new users. Scale could mean, working with 100 different companies, right? How do you look at it from a scale perspective? What do you feel is the direction that makes a lot more sense? Is it more doctors, more specialities, working with more companies, or how do we look at it internally in that sense?
We very strongly believe it. Like at any point in time, like I said, when that interaction has happened between, say, a provider and a seeker, so the owner is always the seeker. The custodian is a provider. The smart, responsible, intelligent vault is what Eka is. So whether someone is using us through developer portal, someone is using Eka Scribe, someone is using Eka Doc, this theory doesn't cheat. So the type of capability that we are building out, we don't have a doubt that we will scale. What will make us very happy will be if everyone acknowledges that this scale is responsible and trustworthy. Because without that, the scale will only be sort of a mirage. See, startups today, right? Probably there was a time when even startups had to be on-prem. Probably that's not the case. When someone is starting to choose anyone, I'll not say, it can be AWS, it can be Google Cloud, but people say, don't worry, data is there. It's not like you're basically having a doubt. 15 years back, as product owners, if you had to basically say that we have to write a technical document on why you are secure, that would be 10 pages. Now it effectively is not more than 2 or 3 pages, where there will be one part that will be fine. On cloud, what are you basically doing? A lot of things are taken care of there. So we have an ambition that tomorrow when our health stack picks up and people who are using us as an end user or as a user who is building their products on our platform, this part that they are the custodian of the owner's data, which will always be case secure. This structure of very smart intelligence has to come from the vault. That will give us a lot of fulfillment.
Very well put. Yeah, very well said.
And in all of the adoption of AI that we are doing, both on the patient as well as doctor side, how and what importance do we see of data security? Because accessing, like if we talk about Eka's health bot, right, it's very personalized on top of a user's data. And then how do we ensure or get that trust that people are still in control of their own data, and that won't kind of get misused or leveraged in any particular way?
See, the way I see this is, especially privacy, security and all, it's the first thing that we must solve and have to solve, and we purposefully build products and everything around that, is you have to give a granular level control to the person who is using the technology on how they want to use the technology. And very important policies such as right to be forgotten or delete your account, all of that has been built with that as a core promise. And I think every product should follow that as an approach, or every technology should follow that as an approach. And that's why whenever we have also built a lot of these things, and health is sensitive information, like it comes under that highly sensitive sort of area, be it patients, be it doctors, and so forth. There are very smart control mechanism that has been provided. Example, secret locker on apps, where a patient would not even want their health data to be seen by the algorithms itself that can generate the valuable insight, right? Now, that is a power that you give to the consumers or users, that this is the power that is there in your hand. On the doctor side, a power that anytime you can pull this data out, delete whatever you have created. It is all there at the back of a button. Not that you have to go through processes, to an extent that if you want to extract the real-time data, you don't have to ask us. You have to just generate an API key and you pull that data out and it's all yours, right? Think of us like a shell with an intelligence. Everything else is not ours. It's practically our consumers' data, our consumers, and that is what we are building. So the architecture, the thought process, the build out, the product nuances have always been driven with these as a guiding principle. Apart from that, we do all the right thing, be it getting tested by a Google authorized partner or a certain authorized partner, do a regular VAPT, and so on and so forth, because data and data governance is quite important. And I would just go back to what Bhaskar have put it, and I think that is fundamentally, it's a very nice way of putting that. Eventually, today, we want to lean on to solutions so that we focus on problems that are on top of it, over and above it, and not necessarily build from ground up, right? And that is what big tech solves for. And I think that can only happen if there is enough and more trust. And the trust layer in health is far more important, because it has many facets to getting things go out of hand. So I think our ambition towards having that trustworthy layer where people are comfortable saying that, okay, now a lot of my boilerplate is all sorted and I will build on top of it, be it doctors, be it patient, be it healthcare providers, is the focus that we'll continue to operate with.
In fact, I'll give a very good example on this part. So see, what was happening initially was, probably let's take a clinic, say a specialty clinic who is very well tuned. They are using our platform. Now there are partners who come in. Probably the clinic will have relationships. Of course, it's all consent based. Probably it would have been very easy, and these are funded clinics. It's not like they don't have technical team and all. Now there is a setup. They can take data anytime from us. They get that data. But effectively now, when there are partners coming in to this whole ecosystem where the clinic is the custodian, patient is the owner, here the clinic, the technology team of clinic is still trusting us and basically asking for enhancements where they are keen on more participation from players, service providers. It could be anyone. It could be someone who is probably giving remote monitoring, or someone who is basically facilitating lab tests, say after the patient has consented. And this particular scope of exactly what data to go to that partner. So this client who has, and there are multiple such clients, they are trusting us. So which means that the platform where this whole definition is being done of exactly what data is shareable with these partners coming in is also done by us. So that is a very good sign for us, which says that at least somewhere the trustworthiness is being showcased in our language, in our product, instead of probably becomes pitch deck. So that's a very important differentiator.
In terms of when we talk about doctors in clinic seeing that trust, if you talk about most of these recent features, how do you see their adoption shaping up? How do you see the enthusiasm from doctors in clinics, specifically towards our, AI capabilities that we have more recently launched? Uh, is there too much enthusiasm to test them out, stick with them? How has that response been?
No, so the start has been pretty great. In fact, see, the whole category, if you see, right, first the category should have that necessary intrigue, or let's say it should be able to draw that attention. Thanks to OpenAI and all keep partners who are coming in, everywhere you see where people realize people are finding their use cases later. First, they want to see what this thing is all about. So at least a decent bit of exactly how life can change is already addressed. Some of the other aspects effectively have of someone's need is already addressed. And I'll give you one more example while I address this part. But here, the type of queries and the type of use cases that are coming out, so that is surprising us every day. So see, beauty about the platform is that when you build, there is a core belief that, okay, fine, these will be certain use cases, and you're flexible about encountering unknown use cases. And those unknown use cases are either pressurizing you to improve yourself, or you are basically met with a lot of delight. So that is the journey that we are undertaking now. Probably we are seeing specialization based nuances, we are seeing regional nuances, and regional nuances which is beyond language. So that tells us that that term, right, of like the parrotlet, which we call as a purpose driven LLM. So this purpose is what we are basically identifying in terms of what will be that solution or a platform that will solve these standard nuances, where there is no adjustment. When there are two participants who are basically talking, they talk very naturally, very normally. The platform does the rest. So that part is we are seeing both Scribe as well as the Doc Assist bit, where doctors are. I have seen again, like one of the doctors was showcasing me. So he started with Scribe, then he was basically testing protocols. Now he has settled on two use cases. He generates the diet chart. Diet chart has to be very, very contextual to patient. He's doing it from the tool, and tool is able to basically service that. So once we understood that part, that okay, fine, diet chart is something very critical, we ourselves wired it up with our say EMR, which helps in basically easy access. So these are some of the interesting use cases that is coming out, and that is what is keeping us very excited. But like I said, regional and language are two areas where we will have to go deep, because that's what the indications are.
Do we, like most common fear people have with AI is, AI will take up jobs. Since you guys are so close to healthcare, what is your perspective in terms of, let's say, can there be AI taking up some jobs from doctors, or will Eka always be a assistant to the doctor, or generally in the healthcare industry? How is this entire topic perceived as?
I don't know. For me, I think I might be biased, but definitely I don't see it more than as being a very, very intelligent assistant, especially given the context in India where doctor-patient ratio is so skewed. I think we have, and also in terms of what it can do and it should do, I don't see it, the scope being more than a very intelligent assistant. And but that in itself is a big thing. Having a very intelligent assistant can really ease out a lot of things at a day-to-day level. And I think, so that's my perspective on that topic. I don't know if you want to add.
See, today the patient is not going to get a treatment from AI. The intent of the patient is to say that I want to get treated by a doctor. So if that is the intent, the AI will always be an assistant to a doctor. If there is a change that happens later where patient says that I am fine being treated with AI, we don't know. At least I don't see that happening now. Still, I want to be treated by my doctor. I want to have my conversations with my doctor. Doctor should be able to be very attentive to what I am saying. Doctor should be able to understand my health context. As long as they're able to do it, they're able to help. I'm fine. So we will be part of that responsible scaling is this part, that let's still continue to be the assistants to the doctors, because there are still tons of things that are still to be explored and all. So at least as far as job is concerned, one job which is very secure is that of a doctor.
Yeah, no, we definitely, in all limited narrow scope of our thinking, if so to say, really underestimate the job that doctors are doing. So it's not about figuring out what is the diagnosis and how it should be, what kind of medication should be given to you. I personally feel that 60-70% of job is before and after that, which is basically to give comfort to that patient and an individual that fundamentally this will get over, and so to say, or talk to the caretaker that these are the steps that we have to take, and I am there with you in that journey to solve for whatever it is. We really underestimate, and I would rather go deep into even more being pretty sure that that there's nothing about jobs getting affected or doctors getting replaced and so on and so forth. We are not thinking in the direction, we are very tactical then. We are not holistically thinking about the job that doctors, rather this will be a very big arsenal in the pockets of doctors, which actually can solve for the time, which today is the most important commodity. When I was not in healthcare, I used to always say in my tech talks that developers' time is very important. Like, obviously, because that's what I used to think about. But if I have to go back and see whose time is the most important,
This time is the most.
it's really so important that if AI can solve for that time to an extent that the doctor is able to just spend a little extra time in talking to the patient itself, it can add to the better outcomes. So yeah, it's quite.
So we do have one more question for you, and then we'll have a fun rapid fire section like we usually do for all of you. But before we go to the rapid fire, one last question would probably be, if I were to look, and, we spoke about it briefly before, where you mentioned that, when you look at Eka, it's more like the health OS of India. It's been 4 years right now that we are into this journey. If I were to talk about, let's say, next 3 years, next 4 years, what do you vision for this health OS of India, and how do you see this shaping up specifically, and the recent times when I would say AI is changing the ecosystem so rapidly, like, I don't know how much can you foresee in terms of, how things would evolve over the next 2 years. So how do you see that vision shaping up?
No, so I think how Bhaskar has summed it up, right? I think I'll go with that. Like, think about us as if you are doing anything in health, right? Be it providing a service to solve for remote patient monitoring or diabetes management or insurance or a very simple data collection by, say, ASHA workers and so on and so forth. Eka should be the first choice or a first thought that, okay, this 40-50% of my problem is already solved. So I should have full trust on Eka as a platform, which would which will become that fundamental building block, and then I will innovate on top of it. So that's how I think we will grow, and our vision is. Obviously, at the heart of it definitely would be AI, because as an organization, we fundamentally feel that there are industries, they get disrupted with technology. And a big disruption for e-commerce industry was internet. Internet came in, e-commerce happened, right? Similarly, if I have to say fintech, to some extent, the disruption for that industry was mobile, right? We feel that health, a big disruption at an industry level will happen thanks to AI, which is like the fundamental technology like a mobile or an internet and so on and so forth. And with that belief, we will invest technically on this while making sure that we have a product that people can trust and build on top.
I remember you once spoke that, how in India people shifted directly to mobile instead of laptop. And instead of, maybe moving to EMRs, doctors probably would first adapt to a healthcare companion. And that probably is what Eka could be.
Yeah, no, I was fortunate enough to talk about to give presentation about Eka to Mr. Bill Gates, and that's the same question. This was a question that he asked: "Are you like an epic of India?" And the answer was exactly the same that we discussed here. That India has not seen an EMR era, which is like doctors typing and creating forms and so on and so forth. Thanks to AI, we will take a step change in our country where AI would eventually build something which is a combination of EMR with an AI tech that suddenly will help in digitizing the way mobile just changed the way transactions happen in this country. AI will change the way health data gets generated, and not only generated, leveraged for better outcome. And I think, yeah, so as of now, maybe is a hypothesis, but I'm a firm believer on that.
No, totally agreed. I think specifically with most of the tools that we have built, Voice to RX, Scribe, I think the adoption from doctors' perspective definitely becomes a lot more easier and the barrier becomes a lot better. Cool. So we'll move to the last fun section where we have some quick rapid fire questions.
The tough questions to the smartest person on the table.
So this time, luckily, we've divided the questions beforehand. Do we start with Vikalp or do we start with Bhaskar? Or Sankalp sir? Okay, so we'll start with Vikalp. So what's the one feature you would want AI to build for you personally outside of the work ecosystem?
I'm a very lazy person at home. So I want to make sure that there's a quick template that can get created where everything is automated. It's a problem for me. Yeah, at home.
If for example,
For example, today also, if I had to have an Alexa connect to my Google Home and start basically automating things and all of that, it's still a task, right? I mean, I just want everything to be automated at home.
At one click, like everything becomes smart at home.
Not even smart, right? It should be like, okay, it knows that morning when my alarm rings, my curtain should also open automatically and so on and so forth. So yeah, it should be smart. It should be smart. It shouldn't be just like a command taker.
Right. Next should be, since we all know how fond you are of coding, would you rather debug 10,000 lines of code to find out a bug in the system or have an investor meet?
Oh my God, this is a maybe now I would prefer having an investor meet because I have realized that there is a lot that also can happen. But I would not go on debugging the 10,000 lines of code. I might as well want to write it again. And thanks to what's happening with all AI-led coding. But yeah, that would be my...
If you could create an AI clone of one of the Eka team members, other than Bhaskar and Sankalp, who would that be?
Who would that be? I would go with... that's a tough question.
Yeah, all three of you, of course.
So I think I might have to pass this one. But I think because as I'm thinking, I can't point out on where that clone would be. Maybe you give me that technology and I'll start cloning one after the other.
Nice. Last question for you would be describe your job in maximum of 3 words.
Talk, talk, talk.
Okay, I doubt if Bhaskar sir agrees with that. But we'll move to Sankalp next, I think. So, first question for you would be name one thing that Parrotlet does better than GPT 4.0, or rather, one thing that, if GPT was sentient, would wish that, I could do this better than Parrotlet.
I think some of the things related with colloquial terms, that's one thing which I'm proud that it does much better than a GPT course. Yeah.
One tech jargon you secretly wished that you could just erase from history forever.
I don't know. Maybe agents. I don't know. I don't know. Like I see them extension of like the workflows which we are used to. It just for me is a new buzzword. Yeah, I'm not a big fan of this whole. Not what it does, but the word.
Okay, next question. What is more terrifying for you, AI hallucinations or shooting videos for YouTube and LinkedIn channel?
That's I think the second, the latter. Hallucinations I can control with something, but yeah, the latter being the more terrifying one.
We'll have to shoot more videos. Oh, really?
Yeah.
Last question, same as the
Think, do, and repeat. I think repeat being the the takes 99% of what I do. I mostly
like sleep, repeat, code, code, sleep, repeat. Cool. Bhaskar sir, for you. One feature request that you received over the last 4 years, which made you laugh, that how could someone have this kind of a feature ask?
So there have been a lot of feature requests. Something like this immediately doesn't come to my mind. But there have been very erratic feature requests.
Or maybe one feature request which was so weird, but that you didn't want to build it, but it eventually came up in the product because you couldn't,
So there are many like these. So sorry, I'll tell you. See, when we started again, I don't have a short answer, but when we started, everything we would see, and we came from a background where everything was fancy UX. You got a B2C company, a successful B2C company, a fancy UX, solid copy, and very, very engaging content. And then when we started evaluating and analyzing products, we were thinking, that why have they built it this way? This is not required. This is not how an EMR should be built. So there will probably a list of like 20-30 features. Me and Vikalp and had fair share of basically making fun of these things. Yeah, well, we need it. Probably out of that, though we have our own way of treating that, but at least half of them. So once we understand the context of that, so we have done that part. I'll give you a very simple thing, a very simple feature like when a prescription pad or a clinical note opens, the last digit should be upfront. Probably there is one click that can happen, and it still can be visible. But no, that that comfort, forget about everything else. When we started talking to people, we realized it is almost like, and one doctor basically termed it very nicely. He said, imagine you want to refer to something, you are basically on stage talking to 500 people, and then suddenly you see that note is not there. You're figuring out. So that gives you a sense of comfort. So there were a lot of behavioral nuances which basically helped us gauge these sort of things. So that will be that one feature.
One idea that we eventually killed at Eka, but secretly you wish that if I was the CEO, I wouldn't kill it.
So that way, at least till now, to be very frank, see, me and Vikal have worked now for almost like 10 years, more than 10 years. So before Eka, we have had fair share of this thing, where there was something that we were very, very emotional about. And we said, yeah, this though, I'll tell you, UPI was one such thing which we were very crazy about from 2015. So here at least we have killed a lot of things and again you can talk about phobia. So anything that borders around, say, getting into a transactional mindset, probably someone else might do a better job than us, but we have stayed away and we very happily killed a lot of such things. So, and the other things where things are very good and then if they are very early feedback, good thing is that any doctor who is using us, doesn't matter he has paid us or not, if he wants to reach us, probably Vikalp will be one mail away and he would be listening from us in less than a day's time, or one of us will be there.
Nice. I think that sums up our podcast for the day. Thank you guys for joining.